guys, one of the perks of working in this office, as you may have seen, is that once in a while, for one of our favorite employees, we do a little nice cosmetic procedure. So today we have our veteran employee, Raj, and she wants me to do masseter Botox for her. Now, for those of you who don't know what the masseter muscle is, it's the muscle of mastication, the muscle of chewing, which is on both sides of the face. And so some patients want to inject the masseter muscle because they have TMJ or they have pain. And these are people who clench their teeth at night. So that's certainly one set of patients that does Botox or masseter. And since Botox relaxes muscles, by relaxing the masseter muscle, that pain goes away. And it's really life-changing for a lot of patients who get Botox for TMJ, Botox for masseter muscle that's over-clenched. Now, there's a second group of patients that do Botox for masseter muscle to slim down if they feel like they have a wide jawline or a wide face. And so the principle behind that is by injecting Botox, by the theory of use and disuse, if you don't use a muscle that much, which Botox kind of decreases muscle movement, the muscle atrophies, meaning the muscle gets smaller. So as that muscle gets smaller, your face is going to look not as wide. It's going to thin out. And so this is a very common procedure among East Asians and Asians because genetically they just have wider faces due to the muscle mass of the masseter muscle in these patients. So here we're going to just do some quick injections for Raj for a masseter muscle. And so I'm going to ice her a little bit right here to do one side. Raj, let me know when that's cold. And you may want to zoom in a little bit on my injections.
It's cold.
Cold. Now, Raj, go ahead and clench for me. I want to show the audience what that looks like. Clench for me. So you may see her masseter. You can actually feel it. I can see the borders of her masseter. Right? I can run my finger around the borders of her masseter. It's right here, and she's clenching it. I can feel it. It's nice and tight right now, so I know exactly where I need to go. And I'm going to give her a little bit of Botox into these areas. And pretty painless, right?
Painless.
And bloodless. So now we're going to do the other side.
It's cold.
You can clench for me, Raj? Again, don't clench, and not clench again. So again, I can feel the borders of her masseter. It's right there. Those are the borders. And her masseter is shaped a little differently on this side. So people ask me, like, where do you inject the masseter? And I think that, it's different for different people because you really have to feel the borders of their muscle and inject and inject accordingly, according to the shape and the size of that muscle. Signing off, Dr. Rockstar.